The United States Surgeon General has released a report highlighting the risk of alcohol use. Now, its consumption is a leading preventable cause of at least 7 types of cancer, behind only tobacco use and obesity. According to Surgeon General Vivek Murthy, alcohol directly contributes to at least 100,000 cases of cancer and 20,000 related deaths each year. Among the cancers highlighted are breast cancer and colon cancer. Murthy is calling for alcoholic beverages to carry warning labels on their packaging, same way that cigarettes do. In order for that measure to be put in place, Congress would need to act. Joining us now, global health policy expert and MSNBC medical contributor, Dr. Vin Gupta. All right, Dr. Gupta, tell me how to make sense of this.
Well, Happy New Year, Alicia. Here's what I would say. You talk to any medical provider, they're probably going to tell you that they've seen the risks of alcohol far outweigh the benefits for any of their patients in their practice. I'm an ICU doc. I see the worst of it. And so this is not new to the medical field. I think a lot of us have wondered benefit versus harm. But here's also important context. When we really think about, for example, take larynx cancer. This is something that was highlighted in the report. And there's a finding here that, moderate drinkers have a 1.4 times increased risk of larynx cancer versus non-drinkers. The context that is needed here, so this isn't just summarily ignored by the American public, is, well, what's the risk of larynx cancer to begin with? Say you're not a smoker, you're eating right, you're fit, you're exercising, and you're engaging in moderate drinking. Fine, that's one risk. But let's say you're not drinking, you're doing all the right things. It's probably pretty low. So an increased risk of 1.4 times a low risk is probably still pretty low. And so that's the context here. If you're doing all the right things, eating right, aerobic activity, you and I have talked about this, and let's say you don't have a genetic history of cancer, your risk from moderate drinking, say a couple glasses of wine, Alicia, on top for one of these cancers is not going to be terribly high. It's not like smoking and lung cancer. So I want to make sure that we have that context here for the American public. Yes, it's a carcinogen. Alcohol is a carcinogen. We don't think it's safe from that standpoint. It might have some heart health benefits. But does it pose the same risk to the human body as, say, smoking does to the lung? No, it does not. And we have to think about this holistically.
We've talked about the benefits of cardiovascular activity because I actually saw you jog past me in New York City. And I said, is that Dr. Vin Gupta? And in fact, it was living his best life, practicing what he preaches. Talk to me about the amounts of alcohol here, because, as you said, there are multiple factors at play, including the amount that you're drinking.
Absolutely. So holistic health, everything matters here. A couple glasses of wine, if properly poured. And Alicia, thanks for the tee up here.
Oh my God, yes.
And this is, either really light white wine or water.
Or vodka or tequila, show me.
And so this is it here. Here's the benefit. This is a properly poured glass of wine. Alicia, for your viewers, I'll bring this up to the camera. And what you want here is, and this is, you're getting dual advice, medical and also wine tasting advice. You want the wine to come up to the point of the greatest circumference of the wine glass. So where it's widest, that's where you want the wine to hit. You don't want it to go after. The goal is not to pour as much wine as fits into the wine glass. That is not a proper glass of wine. It's up to the widest point. And here's the benefit from a wine tasting perspective. It's actually going to create the most amount of surface area for oxidation. So it's going to be better tasting wine, better for your health. You're not going to risk over drinking. And that's really the point here. Yes, wine, beer, liquor, they are not safe in any amount. There is a carcinogen. They are a carcinogen. That we've known that. I'm glad that this is out there. Are there potential heart health benefits? Yes, there's pros and there's cons. If done properly, 1 to 2 glasses is my recommendation at most. Properly poured, not over pour, you can enjoy your life. And I think that's the point here. Moderation is still recommended. And we need to think about risk holistically and in context.
A doctor and a sommelier. Talk to me about gender. The Surgeon General pointed to 1 in every 6 cases of breast cancer attributing to alcohol.
There is that link, and breast cancer, and that is why actually amongst women, we recommend 1 glass or 1 pour, 1 beverage per day as the maximum daily allotted amount versus for men, it's up to 2. Again, these might be revised. But there is that link that we're seeing, that link to breast cancer specifically, potentially even colorectal cancer across both genders. So it's important to keep that in mind, Alicia. I think this is all evergreen here as we're talking about these new risks in new ways, even for moderate drinking. That breast cancer risk is something to keep in mind. And if you are watching, let's say you're somebody in your late 30s, early 40s, and you're somebody that engages in moderate drinking, that should be informing making a primary care appointment, making sure you get your mammogram scheduled. Remember that age now is 40, it was 50, it's now 40. Do all the primary care screenings, stay active, eat well. You can enjoy a glass of wine. The point here is holistic risk, not just looking at one specific risk factor and what it might portend for your health.
Can you help me understand something from a public health perspective, which is the Surgeon General makes this recommendation, but as we said in the opening, it would take Congress to actually vote on this for us to begin seeing that type of warning on an alcoholic beverage. What then becomes the societal value of the Surgeon General simply saying this warning ought to exist on alcohol?
Well, I think the benefit here is we're talking about it. You and I are talking about something that if he did not actually issue this, we're probably not talking about it right now. So we're having a conversation about moderate drinking that we weren't having all these many years and all these many decades. We're actually calling that it's not potentially just only good for you, that there might be some risks here. Previously, we said moderate drinking, great for the heart, didn't even talk about the cancer risk. Now we're talking about both pros and cons.
Dr. Vin Gupta, as always, thank you so much for joining us. And thank you for that incredible display of how to pour a glass. We're going to take a quick break, and we'll be right back.